Good morning, friends. This is a continuing lesson in the IAOS Ozone course, lesson number 17. We are showing a demonstration of the world's first non-dialysis filter, EBOO system, 5th generation, and the whole procedure. EBOO means extra corporeal blood oxygen ozonization, EBO or EBOO. And in this video I am presenting to you the world's first filter free EBOO, world's first system which uses 100% borosilicate flint free special sterile flasks. And the good part is that these flasks are autoclavable and reusable, avoiding repeated expenses for disposable dialysis filters. This is the Prakash Prasham Arul system, pending patent for the invention. Though major autohemotherapy is a common and routine procedure, EBOO remains a very less performed procedure. In MAST, 50 ml of 70 micrograms of ozone is diffused into 50 ml of heparinized blood. In EBOO, the principle is to continuously withdraw 1 to 2 liters of blood, ozonize it, and retransfuse it back into the patient. The indications are same as MAST, but EBOO is 20 times more effective than MAST, and the total duration of treatment is reduced from 10 MAST sessions to a single session. Please remember, unless you can put two 16G venflons in both elbows, you cannot perform EBOO. This video is a step-by-step procedure with improvements, modifications, and latest developments in IAOS Mark 5 machines and Mark 6 machines. Please do not use cheap local ozone generators requiring high oxygen inflow and outflow volume wise. To avoid blood frothing and foaming, flow should be low and constantly monitored. We recommend Mark 5 and Mark 6 machines where we can get 1/16th, 1/32nd of oxygen per liter to avoid foaming, frothing, and proper ozonization of the infused blood. This is a very important thing. Do not use it with inadequate, improper, cheap local machines. The ozone therapist must constantly monitor blood inflow, blood outflow, heparin mix ratio, and ozone inflow into the bottle. Unlike renal filter based EBOO systems where very low concentration of ozone is used, in this system 70 micrograms per ml of ozone is used. If the blood froths and the bottle gets full of bubbles, ozone inflow is stopped till the bubble level comes down and the blood level is maintained. Similarly, the EBOO flask is maintained at 60 to 70% filling capacity. We do not want to overfill the EBOO flask. If the level gets lower, we reduce the blood inflow and increase the perfusion pump speed. On the contrary, if the EBOO flask level becomes below 40%, we decrease the transfusion rate, speed up the perfusion pump to get better levels. The Prakash Prasham Arul Eboo system does not use any renal filters or non-ozone compatible material like cellulose triacetate. The color change of the blood is due to actual ozonization and not renal filters or dilution with heparin. For details about the system, you can personally WhatsApp message on the above number, no calls please, and henceforth the videos will show the procedure. We first extract half ml, 0.5 ml of heparin from a 5000 ml, 5000 units per ml bottle, meaning we have taken 2500 international units of heparin in a syringe, and it is mixed with sterile water for injection to make a volume of 5 ml. The syringe is capped and kept closed. A tourniquet is applied. A vein is identified. If you are able to insert a 16 gauge venflon, only then we will do an EBOO procedure. If a 16 gauge venflon is not going into the vein, we shall abandon the EBOO procedure and go with a major autohemotherapy. In this case, we have been able to locate a vein, and the 5 ml heparinized syringe is put into the vein. We now take heparin and saline to dilute it to 5 ml and keep the syringe ready for the opposite side. Then 4 ml of heparin amounting to 20,000 international units is extracted, injected into the saline bottle. The bottle is shaken to mix the heparin. 5 ml of the heparinized saline is extracted into the syringe. This syringe is kept aside and will be utilized for the opposite side for perfusion. We can see that now the patient has got 2 good venflons. The tourniquet on the recipient side is removed. This is a Prakash Prasham Arul Eboo flask, which is a transparent glass borosilicate flask with a stainless steel diffuser. This special hanger has been made out by just cutting a plastic bottle. As hangers are being designed, that is the transfusion set, and we can open it up. It has got multiple components. It has got a filter-free component for the heparinized saline, a filter component for a blood in, and a blood inflow to the patient or a blood out. So the filter-free portion is attached to the heparinized saline, and the entire set is allowed to be heparinized. Now we block both the ends of the tubes and push the filter part of the set into the special borosilicate flint free glass perfusion set. This set has got a stainless steel diffuser. We now take a silicone tube. This tube is attached to a needle, 16 gauge needle. The needle is bent at right angles and the needle is pushed into the plus mark of the EBOO flask to ensure that the ozone goes into the diffuser, so that the diffusing ozone is bubbled through the freshly drawn blood. Ozone is sterile, but still it is better to use a sterilized silicone tube. The ozone vent or the needle for excess ozone to escape is put in the air vent. The other end of the ozone tube, the silicone tube, is connected to the ozone machine, from which ozone will later bubble into the bottle. We adjust the flow at 1/8 or 1/16 of liter per minute. Switch on the ozone machine and wait for a minute to ensure that the bottle gets perfused with ozone and is extra sterilization and protection. The IAOS perfusion pump is a cute, lightweight, small perfusion pump into which the silicone part of the perfusion system is attached. This will start sucking the blood from the patient and pushing it into the EBOO flask. We can now remove the syringe and attach the suction system from the perfusion system. The syringe is attached to the upper portion of the ventricle in case it gets blocked. We adjust the direction of the flow and switch on the machine, in which in this case it is 34 milliliters per minute. The suction in is open and we wait for the blood to be drawn from the tube and pulled up through the heparinized saline set and move into the bottle. You can see that the patient who has had multiple MASTs in the past is watching at the procedure rather curiously. The speed of the pump decides the rate of the flow of blood into the glass EBOO flask. The patient has been connected to a monitor. We check his pulse and oxygen saturation. Blood has started flowing into the machine. Due to the high suction, there may be occasional kinks which has to be sorted out. And we can see that the blood is constantly flowing. Ozone flow is started to start ozonizing, and to protect the clinician and the patient and the attending staff from breathing ozone, an ozone mask is used which is worn by the entire team during the procedure. This ozone mask is activated charcoal based reusable mask, and we ensure that the blood is drawn at the appropriate rate. The next set is the transfusion set. Once 50 to 60% of the EBOO bottle has been filled, then and only then from the lower part the transfusion set is connected, pushed in, the flow chamber is made to fill up, and after the transfusion set is emptied of the air, is this connected to the patient's contralateral or opposite vein. Even now we can see the difference between the violet colored inflow blood and the tomato red blood that is going back into the patient. We monitor the cardiac status, we monitor the oxygen saturation of the patient. This is a polyarticular rheumatoid arthritis with an overlying ankylosing spondylosis, with very restricted chest movements, and even its resting oxygen saturation is only 94 or 95. The flow of ozone is adjusted, the inflow is adjusted. We have to ensure that the level of the bottle stays around 50 to 60%. Heparin is reduced dramatically. We do not want to inject more than 10 to 12,000 international units of heparin into the patient during the entire therapy session. The session will take 20 to 25 minutes, where about 2 liters of blood will be ozonated and retransfused to the patient. Depending on the amount of frothing or overflow of the bottle, both oxygen inflow and ozone outflow are adjusted constantly along with the heparin flow by the operator. We constantly check with the patient whether he is feeling nice. We can see from the above that his saturation at the start of the procedure is increasing. From 93 it has gone up to 96. We have got a comparison between the inflow and outflow, and you can see that as the blood is getting oxygenated, there is a significant difference. The violet colored venous blood is becoming cherry red arterial color. We constantly adjust the inflow and outflow. The vent flans are connected and taped with an adhesive plaster to ensure that the flow remains open. From one side, blood is being pumped in, pulled, extracted, pushed into the bottle, and from the other side, it is pushed back into the patient after ozonisation. The entire process of inflow and outflow is controlled by the therapist. In case the bottle collapses, we can put airways into the saline bottle and ensure that it does not collapse. So ozone is coming and going into the flask. It is bubbling the blood, it is turning into cherry red, and from the output part, the ozonized blood is reaching into the patient. We must ensure that the machine is capable of producing not more than 70 micrograms even at 1 by 30 second or 1 by 16th of a liter flow of oxygen. Whenever the froth in the bottle grows high, we will adjust the flow of ozone so that the blood doesn't froth. So you can see that heparinized saline and the patient blood will prevent any coagulation, and the rumors or misconceptions that high doses of ozone will cause hemolysis are thoroughly misconceived by unscientific practitioners. You can see now the difference between the venous blood and the ozonized blood, which is brighter than the arterial blood. By now the patient's oxygen saturation has increased to over 99%, and the patient is constantly monitored. We inquire about his welfare, we inquire about his happiness, and we ensure that he is fully comfortable during the procedure. Unlike conventional renal dialysis filter procedures, where the patient has to be horizontally crucified for 24 to 48 hours, from 40 minutes to 2 hours, here the entire procedure finishes in 18 to 24 minutes, depending on the availability of the vein. As explained earlier, ensure that you get 2 good veins. Once we feel that about 2 liters of blood has been ozonized, the syringe is removed from the EBOO tubes, the inflow is stopped, the pump is stopped, the tube is removed from the pump. After the entire blood is emptied into the EBOO bottle. Once it is emptied into the EBOO bottle, we close the perfusion pump and we remove the tube from the perfusion pump, and we disconnect the EBOO flask and the heparinized saline bottles. Because our inflow job is over, the ozonized blood that remains in the EBOO flask shall be slowly transfused into the patient's body at a constant rate of 40 to 60 drops per minute. You can see that the blood that is flowing back to the patient is cherry red and properly ozonized blood. The ozone machine is switched off, the regulator is put to 0, the needle for inlet is removed from the silicone tube, and the silicone tube is removed from the ozone machine. We now just have the borosilicate flask from which blood is flowing into the patient's recipient vein, and despite the green color bottle, you can see the bubbles and the bright red blood, ozonized blood that is flowing into the patient. Please remember that in this system we do not use any renal filters. These borosilicate flint-free glasses are reusable. One has to just buy the inflow and outflow transfusion sets. The same bottles can be autoclaved and used for multiple times unless you break the bottle. The silicone stoppers and The bottles are available. The perfusion machine is switched off. The remaining blood is allowed to flow into the patient. As we can see, the patient is extremely comfortable. The saturation is now 95 as the inflow has stopped. However, in another 10 minutes, he will have a saturation of close to 99. We patiently wait for the blood to be emptied. You can see the ozone bubbles and also see the bright tomato red color, and the patient says that he is feeling very happy, showing a thumbs up sign. This case is a patient of polyarticular rheumatoid arthritis, having one hip replaced, was wheelchair bound, but after Mukherjee regime and multiple MAHT has had the courage to travel in a motorcycle from Chennai to Palakkad and is getting his first EBOO session. Once the blood is emptied and reaches exactly 7 inches from the venflon, we close the inflow and block the venflon. Both venflons are retained for about 30 minutes should we need to perfuse or infuse any medicines or drugs for this patient, at the end of which we can remove the venflons. Once the venflon is removed, we must ensure that we have an adequate padding and tightly wad the venflon sides, because the heparinized sides tend to bleed if not bandaged or packed properly. This procedure has gone step by step unedited to show you how a 20-minute procedure has heparinized close to 2 liters of blood. You can see the bubbles in the flask and can understand the procedure properly. The set can be removed. Here it is being removed to show you the set with the transfusion part and the locally made cut plastic bottle diffuser holder for the Prakash Prasham Arul Eboo system. For full details about the system or the machines or further lessons about the scientific use of ozone in all medical conditions, please message the above number in WhatsApp. This number is not meant for voice calls. Thank you very much. Thank you.